Good afternoon. Welcome to the first meeting of the House Standing Committee on Local Government. Call this meeting to order. Ask the clerk to please call the roll.
Representative Ballman. Representative Bray. Representative Brown.
Here.
Representative Chester Burton.
Present.
Representative Doan.
Present.
Representative Fleming. Present. Representative Freeland.
Present.
Representative Griffey. Here. Representative Hampton. Representative Hart.
Here.
Representative Imes.
Present.
Representative Lewis.
Present.
Representative Maddox.
Here.
Representative Meredith. Representative Raymer.
Here.
Representative Rorks.
Here.
Representative Stalker.
Present.
Representative Witten.
Here.
Vice Chair Neighbors. Chair Flannery.
Here. Appears that we do have a quorum, so we are duly constituted to do business. Do any members have any introductions they would like to make? Okay, seeing none, I would like everyone to welcome she's interning for LRC staff this session, Tiana Raspberry. Make her feel welcome for her first meeting. And typically we do meet on Tuesdays at 9, but obviously with the weather this week that changed, and we're having our first meeting today, and we have quite a bit on the agenda. If you don't like the first topic, stick around. You may like the second one. We've got cigars, chickens, landfills, libraries, and fluoride. So a little something for everyone. I would like to announce I will have a 24-hour rule on any committee subs or committee amendments that will need to be filed 24 hours prior to the committee meeting. And I do want to take this out of order. We do have quite a bit on the agenda today. I would like to finish in an hour if possible. So if everyone can be mindful of time, both the proponents and opponents of the bill, I am going to try to go out of order because there's a banking and insurance meeting going on, and I believe they have some we have some members that just came in from that meeting, but there's also some votes going on over there as well, so we may have members coming in and out of the meeting. But the first bill I would like to take up is House Bill 108 by Representative Raymer. Representative Raymer, if you could introduce yourself to the committee, please, and proceed with your testimony.
Representative Rebecca Raymer, District 15. Thank you, Chair. Thank you for committee. So this is House Bill 108. We heard this topic during the interim, and we actually passed this same bill through the House last session. This deals with landfills, specifically residual waste landfills. Basically what it says is that if the landfill and the company are located together, everything continues as it is currently. But if the landfill and the industry are located in separate counties, they are subject to local determination. It only affects residual waste, doesn't affect solid waste landfills. And I'm happy to answer any questions.
Motion on the bill.
Motion on the bill.
Motion and a second on the bill. Any questions from members of the committee? Motion made by Imes, second by Chris Lewis. All right, as Representative Raymer stated, we did actually vote on this last year. It passed the House. I know there was some heartburn by different industries, and they informed me during the interim that they seem to be okay with this. So I don't see anyone signed up to testify in opposition to this bill.
And KCL and KCO are both on board with this.
Okay, thank you. Madam Clerk, please call the roll.
Representative Ballman? Yes. Representative Bray? Representative Brown? Yes. Representative Chester Burton?
Yes.
Representative Doan?
Pass.
Representative Fleming? Representative Freeland?
Yes.
Representative Griffey?
Yes.
Representative Hampton?
I'd like to record my attendance, please, and yes.
Representative Hart?
Yes.
Representative Imes?
Yes.
Representative Lewis?
Yes.
Representative Maddox? Representative Meredith? Representative Neighbors?
Yes.
Representative Raymer?
Yes.
Representative Rorks?
Yes.
Representative Stalker?
Yes.
Representative Witten?
Yes.
Chair Flannery?
Vote yes. We have 13 aye votes and two pass votes, so the bill does pass with favorable expression. Congratulations, Representative Raymer.
Thank you.
Next up, I'm going to take House Bill 194 by Representative Chris Lewis. Representative Lewis, I believe this bill does have a committee sub. Do I have a motion? We have a motion and a second. All in favor say aye. Does pass. All right, so we have before us the committee sub. Representative Lewis, if you would introduce yourself for the record, please, and tell us about this committee sub.
Yeah, thank you, Chairman Flannery, Vice Chair Neighbors. Chris Lewis, House District 29. The House sub only has one change, and that is simply to change the sales threshold from 15% to 25%. That's the only change in the sub. I appreciate the opportunity to talk about the bill today, Mr. Chairman. This bill did pass the local government committee last session, passed the full House and the Senate committee, and unfortunately, the Senate ran out of time to consider it at the full Senate. I'd like to start by explaining what this bill does not do to clear up any misconceptions that might exist. This bill does not fully roll back existing smoke-free laws in any local municipality in the Commonwealth. This is not about smoking cigars in a regular bar, your local bowling alley, restaurant, or in any other public place that doesn't currently allow smoking. If you don't want to be exposed to cigar smoke in a public place where smoke-free laws currently exist, nothing in this bill changes your ability to maintain that separation. What the bill does is to create a narrow exemption that will allow for smoking of cigars inside of what is very tightly defined as a cigar bar. In order to meet the definition of a cigar bar, the business must have 25% of its gross annual revenue.
We have a motion by Representative Baumann and I believe a second by Representative Griffey. I'm going to give an opportunity for any members of the committee to ask questions at this time. As he stated, this is a bill that passed the House last year, I believe was heard in the Senate in a committee meeting. Did not pass the Senate. There's been a slight change, but this is not a new concept for us. All right. Seeing no questions, I'm going to call this to a vote. Madam Clerk, please call the roll.
Representative Ballman? Yes. Representative Bray? Representative Brown?
Explain my vote.
Yes,
No.
please.
I vote no on the proposed ordinance, and I vote no because we in Lexington have a no smoking ban, and I think this is counter to local control, and it's a problem for Lexington County, so I vote no.
Representative Chester Burton?
Yes.
Representative Doan?
Yes.
Representative Fleming? Representative Freeland?
Yes.
Representative Griffey? Representative Hampton?
Yes.
Representative Hart?
Yes.
Representative Imes?
Yes.
Representative Lewis?
Yes.
Representative Maddox?
Yes.
Representative Meredith? Representative Neighbors?
Yes.
Representative Raymer?
Yes.
Representative Rourke?
Yes.
Representative Stalker?
Pass.
Representative Witten?
Yes.
Chair Flannery?
Vote aye. The bill does, as amended by the committee sub, does pass with favorable expression and should pass on the House floor. Thank you very much.
Thank you, Mr. Chairman.
All right, next up, House Bill 276 by Representative Doan. This has a committee sub, doesn't it? It does not. The Florida bill has a committee sub.
You ready for me?
I am ready. Ready for an omelet as well.
Thank you, Mr. Chairman, members of the committee. Representative Steve Doan, House District 69 in Boone and Kenton counties. What we've got before us is a simple one-page bill that would authorize backyard chickens here in the Commonwealth. No local jurisdiction could prevent anyone from having less than 6 chickens, and there's still carve-outs here in the bill that allow local governments, whether county or city, to set setback restrictions. I met with folks from the League of Cities. They do oppose the bill. However, I would ask for your consideration on this vote.
A motion and a second. Who made the second? Representative Maddox. Any questions for members of the committee? Doesn't appear that anyone has signed up to speak for or against this bill. Wanted to address one issue that I've had people ask me about on homeowners associations. Would you like to address that?
Sure. A homeowners association, that would be a separate contract, a private contract with a deed restriction. This bill would not impact homeowners associations. So if your homeowners association doesn't want chickens, they can still have it that way.
They cannot be sold for commercial purposes. Is that correct?
That's correct.
So this is for more
Personal
or less
use.
Personal consumption.
Yes, Your Honor. Yes, yes, Chairman.
I'll take that. All right, let's take a vote on this. Madam Clerk, please call the roll.
Representative Baumann? Yes. Representative Bray? Representative Brown?
Pass.
Representative Chester Burton?
No.
Representative Doan?
Yes.
Representative Fleming? Representative Freeland?
Yes.
Representative Griffey? Representative Hampton?
Yes, but I'd like to reserve my right to change my vote.
Representative Hart?
Yes.
Representative Imes?
Yes.
Representative Lewis?
Yes.
Representative Maddox?
Yes.
Representative Meredith? Representative Neighbors?
Yes.
Representative Raymer?
Yes.
Representative Rourke?
May I briefly explain my vote? I'm going to vote no today. I do view this as kind of a local control issue around local governments knowing their city's best for how to manage chickens, but I love a chicken, and I'm happy that they produce good quality eggs for our constituents, but just I think this is better handled locally. Thanks.
Representative Stalker?
Yes.
Representative Witten?
Yes.
Chair Flannery?
Vote aye. The bill is carried with favorable expression and should pass on the House floor. Thank you very much, Representative Doan. Next up, see our good friend Nick Wilson on the front row. If you could come forward for House Bill 290.
Yes, sir. Thank you, good friend, Mr. Chair.
If you could introduce yourself for the record, please, and please proceed.
I'm Nick Wilson, District 82, and thank you for holding this meeting and giving us a couple days to avoid that snow. I'm presenting House Bill 290 today. It relates to county law libraries. In the current statute, the local bar associations are able to provide legal resources for the law library. However, it's just books. The issue was brought to me by my local bar association, and apparently it's a common theme around the state where local bar associations will have tens of thousands of dollars just sitting there and really nothing to do with them. What this bill does is allows them to use that money, their own money, by the way, is not state money, to use their own money to pay for online legal research and computers and the like to put in the county law library. So I think it'll be very helpful. The law libraries right now are very underutilized because, as you know, Mr. Chairman, as a practicing attorney, a lot of the stuff is just done online now. A lot of the research is online. And in fact, I've seen the new books come in boxes and they're just sitting there. They're not even taken out of the boxes. So I'd be happy to answer any questions.
We have a motion and second on the bill. Bauman wouldn't. This bill did pass the House last year, did not pass the Senate. I think this is an issue, and every county does have a law library. I do know if you go into a lot of justice centers where they are located, typically you will see boxes of the fill-ins for the different books and just new books that come in, and you often are not even taken out of the box. And as you stated, a lot of this is done online. This would give practitioners or the public that wishes to utilize the law library as a resource the opportunity to have access to this online for research, and most of that that's where most of this is going now. And all the books look nice on a bookshelf in a lawyer's office, but most of this is done online. So I do think this is something that could actually be the best usage of the monies that are set aside for these law libraries in every county.
And that is another great point. I may have not hit on it. The law libraries are open to the public. You don't have to be a lawyer or a member of the Bar Association to use it.
All right. Any questions or comments from members of the committee? If not, Madam Clerk, please call the roll.
Representative Bauman,
Yes.
Representative Bray, Representative Brown,
Yes.
Representative Chester Burton,
Yes.
Representative Doan,
Yes.
Representative Fleming, Representative Freeland,
Yes.
Representative Griffey, Representative Hampton,
Yes.
Representative Hart,
Yes.
Representative Imes,
Yes.
Representative Lewis,
Yes.
Representative Maddox,
Yes.
Representative Meredith, Representative Neighbors,
Yes.
Representative Raymer,
Yes.
Representative Rorks,
Yes.
Representative Stalker,
Yes.
Representative Witten,
Yes.
Chair Flannery.
Vote yes. Motion does carry with favorable expression and should pass on the House floor. Thank you.
Thank you, Mr. Chairman.
All right, last on the agenda, we have House Bill 103. It looks like we do have testimony in opposition to this as well, but you and any co-sponsor take a seat. We do have a committee substitute. Do we have a motion on the committee sub? Motion on the sub. First and a second. All in favor of the committee sub, vote aye. Any opposed, nay? It does carry. So we have the committee sub before us. All right. If you all could introduce yourselves for the record, please, and then please proceed.
State Representative Mark Hart, 78th House District.
Representative David Hale, 74th House District.
I'm Dr. Jack Call, dentist in Louisville, Kentucky, and also executive chair of the International Academy of Oral Medicine and Toxicology.
All right, thank you, Mr. Chair. This bill has been talked about and debated for 9 sessions now. The only change to the bill this year, as we testified in state government this summer, is we've added an immunity clause that would allow the water districts to be immune from civil action regardless of whether they keep fluoride in the water or would take fluoride out. Okay. All right.
If you want to continue, I was going to give you an opportunity to speak on this to just a little bit more, and then you may have some questions and then I'll let opposition come up.
The only additional thing I'll say is just the committee sub clarifies the immunity. There was some language question, and I met with the trial attorneys in leagues of cities, and with their help, we were able to correct it, and that's what the committee sub does. It just clarifies better the immunity clause. With that, I'll let Representative Hills.
Thank you, Representative Hart. Thank you, Mr. Chair. I'm just here today to show my support for this piece of legislation. I've been the primary co-sponsor of this bill for the last 4 or 5 sessions that we've had. I believe in it. If I didn't believe in it, I wouldn't be here today. I think it's a very important piece of legislation that we need to implement. Of course, I know the gentleman here to my right is far more expertise on this than I am, and I'm sure there's some testimony that will probably be in opposition to this. But in people that I have talked to, even in my own local area, this is something that's really very important to a large majority of people, our local officials as well as just local residents. But I want to commend Representative Hart on being persistent with this. We have passed this through the committee, through the House, and hopefully we can get it all the way through this year. But thank you, Mr. Chairman, for just allowing me to speak. And again, I ask your support for this piece of legislation. Thank you, sir.
And if I could just add, 2 states in our country, Utah and Florida, have banned, just a total ban in their entire state, the addition of fluoride to the water. And just a couple reminder points. Typically, the type of fluoride that's added is not pharmaceutical grade. It is an industrial waste product. There's been a lot more research published over the last 7 to 8 years. These are studies funded by our National Institutes of Health, high-quality studies published in high-quality journals. And in addition, the government released the National Toxicology Program's report about fluoride, which reviewed dozens of studies that have been published showing a trend of association between lower IQ and the level of fluorides consumed by the pregnant women and their and then the infants after birth. So there's this risk, and even though we don't have all the answers, when there's that kind of a risk, I think it's prudent to apply a precautionary principle. There's issues about dosage. We fluoridate with 0.7 parts per million. And the study showed real significant issues with 1.5 parts per million, to where the amount that we're adding, the 0.7, still doesn't leave a margin of safety, which typically experts suggest as being 10, which would say maybe 0.12 parts per million would possibly be okay. But again, I just urge you to consider the precautionary principle in this matter. Thank you.
Just one last word. I just want to emphasize to everybody, this bill does not ban fluoride. It takes away the state unfunded mandate and makes it a local control. Thank you, Mr. Chairman.
All right, I'm going to open this up for members of the committee to comment or ask questions to the panelists before us, and after that, I'm going to allow the opportunity for any opposition to speak. All right, recognize Representative Stalker.
Thank you so much, Chairman. My question actually is for the gentleman from Louisville who is the dentist. Could you please let me know two things? One, I'm curious whether it's within your office or standard practice within dental offices to offer patients an application of fluoride on their teeth when they come in for cleanings.
Yes, that is a commonly utilized method of applying fluoride or to seek protection that fluoride can offer under what we call a topical, a surface contact. And then that allows for that freedom of choice. And it's a very common procedure. It's covered by insurance and is readily available.
Follow-up question, please.
Yes.
Is that something that you recommend or encourage patients to do that topical versus
we use what we call an informed consent process. Engage the patient to personalize our treatment. And I might differ a little bit from some of my colleagues as far as some offices just make it a total standard of care. This is what we're doing, and they have that policy in their offices. I'm more cautious about it, and a lot of patients actually come to me because they don't want the what sometimes is more of an oppressive application of policy in an office, that they feel intimidated by the dentist and the hygienist, the dental staff, as not being respectful of their personal choices. Again, informed consent is essential here, and that's the problem we have with water fluoridation. If you don't want it, you're kind of stuck. You either get expensive filters or bottled water. And in my opinion, that just really is just a travesty that we just don't have that freedom of choice.
Just one follow-up comment. I would say that while insurance may cover a portion of it, it does not cover 100%. I have personally experienced, getting that application for myself or for a child, and they're still, at least with my personal insurance. So it's not an across the board that it's, completely covered like a cleaning might be on a regular basis. But thank you so much for your answers.
Good.
All right, Representative Rourke.
Thank you, Chairman. Representative Hart, I have a question for you. So in terms of this going back to local boards, what public health or medical knowledge do those local board members, what are they required to have?
They'd be required to have the same knowledge that we would as a legislature. None of them's experts in this field, and we're asked to make decisions, and we don't have the medical knowledge. And these elected boards or appointed boards, they're not going to have the medical knowledge either. They're going to have to seek out professionals like I have to help inform us, and so they can make our decisions on an informed basis and on recommendations from the experts. But there's not a board out there, just like there's not a legislative body out there that are experts in these areas. These decisions need to be made between the patient and their doctor, not the patient and the government.
Who regulates who regulates it now, and are they required to have a certain level of medical expertise?
In the state of Kentucky, the Division of Water regulates it. The federal EPA regulates it on a federal level. As far as their level of expertise, you'd have to talk to the organizations.
And just one additional question I had was around systems like Louisville that maybe also supply water to other parts of the state. For example, I think Louisville Water Company supplies to Shelbyville and Hardin County in particular. which system would then trump another system for choosing if they were to continue with fluoride or to remove it?
There wouldn't be no trump. The system producing the water gets to make the decision. Whether or not their customers want to buy from them or not after they make that decision, that would be in the realm of their auspice as a business. It's not the government's job to regulate their business either.
Thank you.
All right, this time I'm going to ask the three people that have signed up to oppose this come to the table. I believe there's a Dr. Robertson, Mary Bunch, and Brittany. It's either Evans or Elam. If you could state your names for the record, please, and proceed with brief testimony.
Good afternoon. My name's Mary Ann Birch. I'm a retired dental hygienist.
Dr. Steve Robertson, Executive Director of the Kentucky Dental Association.
And I'm Brittany Elam. I'm the Policy Specialist with Kentucky Voices for Health.
Good afternoon. Thank you for allowing me a few minutes of your time to speak today. I'm here on behalf of the Kentucky Dental Hygienists Association. As a dental hygienist who practiced for 42 years, my main focus was prevention of dental disease for my patients. My husband, Dr. Gene Birch, grew up in Louisville. He was a patient at the University of Louisville Dental School as a child before fluoride was added to the community water in the early 1950s. He had many cavities as a child. He saw firsthand the effects of the community fluoridation when he practiced dentistry here in Frankfort for 37 years. He urged me to share his story with you this afternoon. For over 70 years, community water fluoridation has been proven a safe, reliable, cost-effective preventive measure to keep strong teeth and reduce cavities for at least 25%. We cannot afford an increase in dental disease, both economically and physically. This will impact our poorer communities, especially in historically vulnerable populations in eastern Kentucky. Many are covered by Medicaid. An increase in the dental decay will increase the cost of Medicaid significantly. There are not enough dentists to provide care for Medicaid patients already because of the low reimbursement rate. Prevention is the best answer. Dental disease causes children to miss school, and dental pain causes them to be distracted when they are present in the classroom. Our dental team includes dentists, dental hygienists, dental assistants who work hard each day to make citizens of Kentucky as healthy as possible with our dental care. Please consider our professional advice and continue to provide consistent fluoride access to our patients in community water and supplies. This is certainly the best use of our taxpayers' dollars for the dental health of your constituents. Thank you for your time.
Good afternoon, Chair Flannery, Co-Chair Neighbors. Thank you for allowing me to be here today and to speak to the importance of fluoride. My name is Brittany Elam, and again, I'm the Policy Specialist with Kentucky Voices for Health. And while I'm here today in my professional capacity, I'm also here as a Kentuckian whose life has been shaped by what it means to have access to fluoride and to not have access to fluoride or dental care. I've lived in both rural and urban parts of Kentucky and have seen how in both access to dental care can become extremely difficult. If it weren't for Medicaid, I wouldn't have had any real oral health care growing up. I watched both of my parents, both who worked low-wage jobs, lose their teeth. For them, not only was it difficult to find a dentist, but it was nearly impossible to afford the amount of dental work that was needed to sustain their teeth after many years of not having that dental care. At KVH, we put the experiences of Kentucky families, much like my own, at the forefront of our work. We go into communities and we sit and talk with folks and we ask them where the problems are and what the problems are. And often, that lack of access to oral health care comes up in those conversations. When we lack access to dental care, any tool that helps us combat tooth decay matters. Oral health providers will generally agree that preventive work is key to maintaining our teeth, and that includes fluoride. In Kentucky, our target concentration goal is 0.7 parts per million, with an acceptable range at 0.6 parts per million. It is allowable to have an operating range up to 1.2 parts per million, and that's in our drinking water, but thankfully in this case it's closely monitored and regulated. And to save money, the vast majority of Kentucky's water plants hover at that 0.6 value. Our Kentucky kids are already experiencing unusually high rates of dental decay. The UK Early Learners Oral Health Survey screened more than 6,000 of Kentucky kiddos aged 2 to 5, and concluded that Kentucky's decay rates are considerably higher than the national average. We have to at least consider what that would look like without fluoride in our drinking water. It's also worth noting that when we compare the cost of care to the current cost it is to fluoridate our drinking water, the cost to prevent decay is minimal. We're looking at about 50 cents per person per year, up to around $1 per person per year. The projected cost of treating that additional decay, however, is far greater. We've seen public estimates suggest, and this is at today's Medicaid rates, that for Medicaid cost impacts alone, if 10% of Kentuckians lost access to fluoridated water, our dental treatment costs could increase by around $20 million per year. This, of course, does not take into account access issues within Medicare, commercial insurance, or the uncompensated care costs or burdens that we see in our emergency departments. I think that we need to be honest with ourselves about our current capacity, and even if we wanted to treat our way out of more decay, we lack the dental workforce to do so, especially in our more rural parts of Kentucky. Our legislature has taken steps recently to help improve that workforce, and I want to thank you all because I think it's important and it's very needed. But in the meantime, we need to ensure more preventive measures are in place. Finally, I'd like to note that the federal EPA has recently announced the next step in what it calls the gold standard scientific review of fluoride exposure and health effects. This work could help us further inform future protective recommendations, and I would urge this committee to adopt their own statewide gold standards that guarantee public notice, public comment, and meaningful stakeholder participation if and when a community considers ending its water fluoridation program locally. As you consider any piece of legislation that would result in communities losing access to safe and effective levels of fluoride in their drinking water, I encourage an approach that avoids increasing preventable health needs before we have systems in place to respond to it. Thank you for your time today and for the opportunity to come and talk to y'all.
Good afternoon. I don't really have a lot to add. I feel like all of that was very well delivered. I think everybody knows the position of the dental community, at least the vast majority of it. And I do feel like today that we are here to speak for the silent majority of people in the state of Kentucky that appreciate the fluoridation of the water and understand the health benefits associated with it that we're able to provide. This has been lauded several times as one of the top public health campaigns in the history of the United States. We are the gold standard in America in the state of Kentucky. We are the state that other states reach out to for guidance and input on how to implement this, and that still happens. So I hope that we take the time to consider this carefully moving forward. Obviously, we're in full support of maintaining the fluoridation of the water. Thank you, guys.
Very briefly, I know Representative Maddox and Freeland have questions or comments, and Representative Rourke. So, Representative Maddox.
Thank you, Mr. Chairman. My question is to our oppositional presenters. And to be clear, this legislation does not ban fluoride, but the majority of your comments have been made in defense of fluoride. And I'm just curious what your take is on the federal court ruling that came down in 2024, Food and Water Watch versus EPA. The court determined by a preponderance of evidence that community water fluoridation at the U.S. recommended optimal level of 0.7 milligrams per liter presents an unreasonable risk of injury to health. Specifically, it poses an unreasonable risk of reduced IQ in children, neurodevelopmental harm, based on substantial scientific evidence from studies, including those reviewed by the National Toxicology Program, showing associations between higher fluoride exposure and lower IQ. That's from that federal court ruling. So I just wanted to get your take because I'm hearing something very different in your defense of fluoride. Thank you.
Yes, and Ms. Elam referenced that the EPA's answer to that is that they're going to do a gold standard review. Trying to choose my words very wisely, but that's an excellent question. We feel that the court overreached a little bit. The preponderance of evidence shows that fluoride has been safe. As a matter of fact, in fall this year, a new article and review came out in Scientific American, which indicated that there were no indications of cognitive decline. In fact, found that in their cohort that they ran the study on, that the children that had grown up with fluoride in their diet, in the drinking water, actually performed better in school than the non-fluoridated children. So, you know, it's sometimes I think we've reached the point on fluoride that the science part of this has turned into a spin contest. And we could have that argument and that discussion for hours and hours and hours. But there is a preponderance of positive studies that show the positive effects that we've gained. And we also have the evidence of the number of major communities that have made the decision to remove fluoride and yet reversed that decision down the road when they saw the effects that it had on the community.
Mr. Chairman, just a follow-up comment, and then 2 states have banned it as a result as well. Thank you.
Representative Freeland.
Thank you. Just a quick question. You'd mentioned just the Medicaid aspect of it, and that's kind of what I'm concerned about in my end of the state in West Kentucky. And in my district, you know, it's 43,000 people. We've got one provider, and that's for in one county, and they take care of 98% of the Medicaid patients. I mean, that's one dentist. And I worry that, and Representative Hart is a great friend of mine. I respect him to no end. But I worry about if you take that one line of defense out, what does that mean to those patients, the ones that Medicaid patients that have no providers? I mean, we have no problem with people with Medicaid, but there's no providers. So how do we fix that?
Yeah, I think you're right to point that out. And our stance at Kentucky Voices for Health, like we always want to make sure that there's a consumer voice aspect to it, and we focus on access to care. And so regardless of what the intent behind this bill is, like we still have to look to our own evidence across the state. And what we can see is that we lack that access, especially in those rural areas. And to your point, sometimes fluoride in the water might be the only trace of fluoride that a family is getting. We can't always depend on a provider to be there to be able to educate, even with toothpaste. If they're able to go and buy their own toothpaste, they still need that education as well. And so we do have those concerns. And like I said before, I think the legislature is doing things now to improve our workforce, and I want to thank you all for that. But in the meantime, we need to take a step back and focus on preventive care.
And one follow-up question.
Yes.
We mentioned the reimbursement rates. I know that's important, Dr. Robertson, that we improve those as a state.
We are obviously in favor of that. We are in the unfortunate situation where I think everyone's aware that currently we're asking the dentist to work at a loss to see those Medicaid patients. So we're attempting our best to address that through the actions of Moab and Representative Fleming and Senator Rocky Adams, and we appreciate all of those efforts because it is our goal to bring those providers back in to provide that access. But, you know, it is complicated potentially by this decision. And while I do recognize that this is not an anti-fluoride bill, and at the interim session, if you'll remember, I addressed that directly, and I appreciate that this is a local option bill. But, you know, the reality is that if people take that local option and they remove that fluoride, there will be financial implications associated with that, and I think we have to be aware of that.
All right. Last comment from a member will be Representative Rourke.
Thank you, Chairman. Just wanted to briefly ask you all, why do you think the decision to fluoridate water should remain with the State Health Department and the EPA through the cabinet as opposed to making this shift?
I believe that those folks have the expertise to do so. I haven't spoken to all local water districts throughout Kentucky, but I think that in implementation this can become very confusing. And with it being a local option where those communities don't have any input, you know, that also places an additional burden if there's no process for them to weigh in as a community and say, yes, we want this, or no, we don't want this.
All right, thank you. With no other questions, we are ready for the vote. All those in favor, vote aye. All those vote against, vote no. We have House Bill 103 as amended by the committee sub. Will the committee assistant please call the roll?
Representative Baumann?
Yes.
Representative Bray? Representative Brown?
Explain my vote.
Yes, please.
Okay. I vote no. I think that we're going down a slippery slope. I think that fluoride in our water has been a standard since the 40s. And I think that I don't think that anything has been explained here today that says that fluoride is, or fluoridation of our water is a problem. So I would vote no on that. Thank you.
Representative Chester Burton?
No.
Representative Doan?
Yes.
Representative Fleming?
Explain my vote.
Yes.
Thank you. Please record me as a yes. I do appreciate Dr. Robinson and his group here to come and put forth. You're right. It's a local decision. We're not getting rid of it. I understand that. I'm going to entrust my local water district to do the right thing, which knowing them, they will probably do the right thing. And so like I say, I think it's probably something that we need to look at. And to answer your question, Dr. Robinson did mention about workforce and work with Moab. It's our intent to look at these reimbursement rates that will drive up and then bring in more dentists into the fold to help that out. So anyway, thank you.
Representative Freeland?
No.
Representative Griffey?
Yes.
Representative Hampton?
Yes.
Representative Hart? Representative Imes?
Yes.
Representative Lewis?
Yes.
Representative Maddox?
Yes.
Representative Meredith? Representative Neighbors?
Yes.
Representative Raymer?
Yes.
Representative Rourke?
No.
Representative Stalker?
Explain my vote, please.
Yes.
I'm a no today. I have a lot of concern about removing what was already referred to as a first line of defense for Kentuckians, and particularly for children. As a former foster parent, I had multiple children in my home over a 6.5 period time frame, and one of the many things that was a reoccurring trend was the lack of oral health care. And so I think about how many kids are living in poverty, how many kids are in our foster care system and become a very transient population. And everybody thinks the next person will take care of that issue for that kid when and wherever they land. And that's simply not always the case. So I am a no for that. Thank you.
Representative Whitten?
Yes.
Chair Flannery?
Vote aye. Okay, the motion carries with favorable expression that the bill as amended should pass. Thank you very much. All right, before we adjourn, we had some members come in. Any members that need to record votes? I believe Representative Fleming, you have a couple.
I do. Thank you, Mr. Chairman. Would you mind to the clerk record a yes vote for House Bill 108 and House Bill 194?
All right. Any other members that have votes they need to record? Seeing none and having no other business before us, this meeting is adjourned.